The bacterium Mycobacterium tuberculosis causes tuberculosis TB, a contagious, airborne infection that destroys body tissue. Pulmonary TB occurs when Mycobacterium tuberculosis primarily attacks the lungs. Patient B is a 36-year-old male soldier in the French Foreign Legion with hemoptysis. Nursing history. For the past history, his medical history was not unusual. When the patient got hospitalized 2 weeks after the initial symptoms, he began to experience progressive fatigue. For the present history, patient expectorated bloody sputum after running on a few other occasions. Bronchoscopy showed a moderate inflammation of airway mucosa, especially the upper lobe. A bronchial washing smear from the left upper lobe was positive for acid-fast bacilli. Pathophysiology. Some predisposing factors such as immunity compromisation, age, and even nationality, and also precipitating factors such as occupation and health assistance collectively contributes to acquiring the Mycobacterium tuberculosis that may be transferred through inhalation of droplets, airborne droplets. After acquiring these third droplets are other inhibiting factors. Inflammation of the alveoli will occur, which is an indication of primary infection of the said illness. Lymph nodes filter drainage, primary tubercle, and necrosis were the one to follow under the primary infection, in which could go down into two categories. If calcified, it may result to gone tubercle primary complex, or in liquefaction, in which through coughing up, it could end up being hemoptysis. Nursing care plan. Subjective data. Patient said that he expectorated bloody sputum after running and on a few other occasions. Objective data. Medical history. -2 weeks after the initial symptoms, patient began to experience progressive fatigue. Clinical examination result. Bronchoscopy showed a moderate inflammation of airway mucosa, especially in the left upper lobe. Diagnosis. Airway clearance. Ineffective may be related to bloody sputum and fatigue. Planning. Long-term objective, within 1 day of nursing intervention, patient will maintain patent airway. Short-term objective, within 5 hours of nursing intervention can identify potential complications and initiate appropriate actions. Intervention. Assess respiratory function noting breath sounds, rate, rhythm, and depth, and use of accessory muscles. Note ability to expectorate mucus and cough effectively. Document character, amount of sputum, presence of hemoptysis. Place patient in semi or high Fowler's position. Assist patient with coughing and deep breathing exercises. Clear secretions from mouth and trachea. Suction as necessary. Maintain fluid intake of at least 2,500 ml or day unless contraindicated. Humidify inspired air and oxygen. Evaluation. Long-term objective, after 1 day of nursing intervention, patient will maintain patent airway. Short-term objective, after 5 hours of nursing intervention, patient can identify potential complications and initiate appropriate actions.
If the patient has a bronchial washing smear from the left upper lobe was positive for acid-fast bacilli as verbalized. Objective, bloody sputum 13080 facial grimace fatigue. Nursing diagnosis, ineffective airway clearance related to presence of bronchial infection and secretion. Short-term, after 2-3 hours of nursing intervention, the patient will be able to demonstrate behaviors to improve airway clearance. Long-term, after 1 day of nursing intervention, the patient will be able to maintain normal breathing pattern. Implementation. 1. Maintain a fluid intake of at least 2,500 milliliters day unless contraindicated. 2. Moisten the air, oxygen inspiration. 3. Assess airway for patency. 4. Assess breath sounds by auscultation. 5. Encourage rest, avoidance of bronchial irritant, and a good diet to facilitate recovery. Dependent. 1. Give medications, bronchodilators, corticosteroids as indicated. Collaboration. 1. Refer to the next nurse on duty. Short term, after 2-3 hours of nursing intervention, the patient was able to demonstrate behaviors to improve airway clearance. Long term, after 1 day of nursing intervention, the patient was able to maintain normal breathing pattern.
Drugs. Rifampicin, isoniazidethium butylpyrazinamide. Rifampicin.
Rifampicin, also known as rifampin, is an antibiotic used to treat several types of bacterial infections, including tuberculosis TB, Mycobacterium avium complex, leprosy, and Legionnaire's disease.
Route of administration. Route per frequency single dose. May also be given twice weekly dosage 600 mg or day. Mechanism of action. Inhibits RNA synthesis by blocking RNA transcription in susceptible organisms. Indications. Acute tuberculosis with other agents. Elimination of meningococcal carriers. Side effects. Nursing responsibilities. Assess lung sounds and character, and amount of sputum periodically during therapy. Emphasize the importance of regular follow-up exams to monitor progress and to check for side effects. Isoniazid. Isoniazid is an antibiotic that fights bacteria. Isoniazid is used to treat and to prevent tuberculosis TB. You may need to take other TB medicines in combination with isoniazid. Route per frequency. Daily dosage 300 mg. Mechanism of action. Inhibits mycobacterial cell wall synthesis and interferes with metabolism. Therapeutic effects. Bacteriostatic or bactericidal action against susceptible mycobacteria. Indications. First-line therapy of active tuberculosis in combination with other agents. Prevention of tuberculosis in patients exposed to active disease alone. Side effects. Ethambutol. Ethambutol eliminates certain bacteria that cause tuberculosis TB. It is used with other medicines to treat tuberculosis and to prevent you from giving the infection to others. Pyrazinamide. Pyrazinamide is an antibiotic that fights bacteria. Pyrazinamide is used to treat tuberculosis TB in adults and children. Pyrazinamide must be used with other medicines.
Health teaching. Having TB means that tuberculosis bacteria are multiplying in your body and can be spread to other people. After taking TB medicine for a period of time, you will no longer be able to spread the disease. Until then, make sure that your family, friends, and the people you work with are tested. Avoid close contact with others until your healthcare provider says it is okay. Keep your hands clean. Be sure to wash them every time you use them to cover your mouth when you cough. When you cough or sneeze, take steps to prevent the spread of TB. Cover your mouth and nose with a tissue. Put your used tissue in a closed bag and throw it away. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow, not your hands. Wash your hands often with soap and warm water for 20 seconds. If soap and water are not available, use an alcohol-based hand gel. Sleep in a room alone and with good airflow ventilation. Limit your activity to avoid feeling tired. Plan frequent rest periods. Keep your healthcare appointments. You will need to be checked regularly for several months to a year to make sure you are free from TB bacteria.